Welcome to our presentation about feedback. In this presentation, I'm going to discuss what kind of feedback is best to foster student learning. We know that feedback is important because it provides us information about performance. A lot of this information, if you think back to if you took a motor performance class, they talked about feedback in that class. They talked about KR, KP, if you remember that stuff, knowledge of performance, knowledge of results. And I could go into detail of any of that stuff. That's not really the purpose of us talking about feedback. But when we give a student feedback, we are giving them information on how well they did or how bad they did. This is true both of clinical skills, both in a laboratory and in our clinical sites, and also in the academic area. Like me, I'll give you feedback on how you do on your coursework. It'll be usually written feedback, but it still will be information about your performance. Hopefully, the feedback will maintain the student's attention on the task. Well, that's hopefully what will happen. And hopefully it will provide students motivation to continue to improve their skills, their academics, and those type of things. So there's all sorts of types of feedback that's been categorized. I modified this table from a PE textbook from Dr. Rink. Really excellent resource for teaching. Got to remember that we meaning athletic training educators, we use information from not just from athletic training education research, but from all sorts of different sources. So what I'm going to do is go over the different types of feedback and then try to give you an example of both. And so my example that I'm going to give is we're pretending that we are in a lab class. We are going over how to do the anterior drawer for the knee, for the ACL. And so I try to give some realistic types of things that we would tell students in that type of setting. So we have two different types of main feedback. One's evaluative, other one is corrective. Evaluative is exactly what you would think of when you're evaluating. I'm having a hard time saying that word right now. Evaluating how well or poorly the task was performed. Whereas corrective, we're trying to give specific details about how the student can to improve. So evaluative is in the past, corrective is for the future. And then from those two types of classifications, we can break them down even to a more specific. So our first classification is general evaluative, which is you're saying, hey, good job, the old pat on the back. Whereas when we give general corrective feedback, it would be don't do it that way. So you're not really giving them any kind of helpful information. Then we can get very specific versus general with evaluative. You pulled hard enough on the knee, so we're evaluating how well he did, and then we can correct that. I'm not saying that these are together, but just an example. We can correct that and be very specific. It says place your hands around the knee, and I could continue and then draw anteriorly. So that's corrective. Whereas we can have positive and negative feedback, where we evaluate it and we says my kids do a better job than you. Obviously, we shouldn't be doing that. We don't want to use negative feedback. Then another one for corrective is try not to let the patient's lower leg move. It was kind of hard for me to actually come up with a corrective negative feedback. So All right, so then we have the positive, which we should use. John, you did an excellent job on an anterior drawer test. So that's evaluative. Whereas corrective is excellent hand position. And so we're being positive and we're being also corrective. Now we can also give feedback to a class as a whole. So this class has approved 100%. That's the evaluative. Whereas corrective is make sure to hold the foot down on the table. So we're just telling that to everybody because we're seeing a lot of people doing some things like that. We can, if we have groups of students, we can give them feedback in our evaluation. We can say this group is not working as well as I know you can. So we're kind of trying to push them a little bit, kind of somewhat negative. The other one is corrective. Help each other do the anterior drawer test. Obviously, we can do individual versus the group. And so we're telling the student, place your hand in the correct position and then pull. That to me, I just realized that that's more corrective than it is evaluative. What it really should say there is you have placed your hands in the correct position. And then the corrective is put your hands here and then pull anteriorly. Then we have our last two types, our classifications. We have congruent and incongruent. Congruent means that the feedback that we're giving them is congruent to what we're trying to teach them. Incongruent means that has nothing really to do with the lesson or the material that we're trying to cover. So congruent, evaluative, you used enough anterior force, and corrective is sit on the patient's foot. Incongruent, your knee was very lax. It has nothing to do with anything. Who cares about your own knee? And then incongruent corrective, look at the patient's eyes. Well, what the heck's that got to do with doing a anterior drawer test? So these are, generally speaking, all of the different types of the classification for feedback. Excuse me. And what I don't go into in this particular lecture is that there is appropriate types of feedback to give with a different levels of learning. So if you're a novice versus an expert, just generally speaking, for the novice learner, learning skills, learning how to tape, just general corrective is probably the better way. Whereas if they're in the middle late stages of their learning towards the end stage of learning towards excellence, then you can give more corrective specific feedback. So because the newer learner is still trying to figure out just the details, and you can give them too much information and they just panic. A lot of information out there on that if you're interested in that. That goes back to motor learning, motor behavior. So what's our best practice for giving feedback? We want to give feedback as quick as possible, especially in the clinical skills. You see a student doing something, let them finish what they're doing, or depending, you got to really see how it goes. But the quicker the better. As a teacher, I try to give you your papers back as quick as possible. So in a classroom setting, that's what we want to do, is we want to try to give students really fast feedback on how they've done in their courses. As you can tell, since we're in week 4 in this class, I try to get your papers back Monday, latest Tuesday, that you've turned out on Sundays, because I think it's critical for you to know how you've done so you can make any kind of changes for your next assignments. The best kind of feedback is going to be both evaluative and corrective. It should be used, and you should use it with the specific and positive feedback when you're giving feedback. These are the best. I guess technically congruent would be the other one that you should use too. So make sure that you give them the positive and specific, corrective, and evaluative feedback. focus on the task and not the person. I am guilty of not doing this in my feedback to students. I say too many yous in the feedback instead of focusing on the task itself. So don't take it too personal. It's just me trying to learn how to be a better communicator on my own feedback. Last best practice, help the students to assess their own knowledge, their skills, their competence and abilities to improve their practice. Help them see how they are doing and help them to recognize how they can continue to improve by giving them the feedback that they need. Because we all need feedback, even if it's sometimes hard to hear. Students need to hear the feedback from the professors. And again, we need to give it from the viewpoint that we're trying to help the student. And now, from a person who tries to give a lot of feedback, sometimes it's good, sometimes it's bad. I'll own up to that. One of the things that really frustrates me as a teacher in this grad program is when I write notes or comments, remarks on students' papers, and those remarks, comments aren't read because the changes that I ask students to make aren't made. Little things like margins aren't changed when I ask margins to be changed. When I give you feedback on APA and the different ways to do it, I'm not doing it just because I'm super anal about APA. I'm doing it to help you learn. And so when I give you information about some of the technical things, the formatting things, I do expect students to read it, to make changes in behavior. Just because if I'm pointing it out, there's a reason why I'm pointing it out. It's to help you in the long run. And our summary. Feedback is necessary. We need to give it. There is a right way to do it, and we need to try to give it back to students as quick as possible. Because if we wait too long, especially with the clinical skills or any kind of motor skills, it's not going to help them learn. You know, last week I was looking at you do whatever. That's not going to help. It has to be pretty quick. Doesn't have to be like within seconds, but it should be fairly quick. And we want to use both evaluative. We want to say, hey, you did a really good job on this particular thing, or you put your hands in the wrong place. Here's how you can fix it. So we want to give corrective, and we want to be positive with a student, and we want to be specific with how to improve their skills and abilities.